Isaac Bogoch joins us from Toronto in Canada. He's an infectious diseases consultant and scientist at the University of Toronto. Isaac, thank you so much indeed for your time. What do you make of this idea, and we hear it more often than before, that we're all going to get it eventually, so we need to learn to live with the coronavirus?
Yeah, absolutely. I mean, we hear this narrative, and there, of course, is some truth to that. This virus is not going away. Eventually, we will all be exposed to this virus. But that doesn't mean to throw your hands up in the air and ignore it and put our head in the sands and ignore how this can impact societies and countries. So even though we'll all probably be exposed, we still need to take steps to protect individuals, to protect communities, and we have the tools at our disposal. We have vaccine, we have rapid tests, we can better ventilate indoor settings, we can do lots of things to help protect individuals and communities from having this virus impact us as significantly as it is.
Have you heard anything more about this idea? Investigations are taking place, but it's still, of course, very early days, that possibly getting the Omicron variant may make a person immune to the Delta variant.
There's some very early data from South Africa. It's laboratory-based data. And again, I think there's a lot of promise to that data. Basically, if it looks like if someone was infected with Omicron, you would have cross protection to other variants like the Delta variant. For starters, that was a lab-based study, but that would come to nobody's surprise, right? It's still the same virus. It's still COVID-19 or SARS-CoV-2. So it's very likely that you would have some reasonable protection against another variant, and even, of course, variants that haven't yet emerged yet. So obviously that's very promising, and I think we can extrapolate from that. And obviously that's good news. It is also pretty clear that this variant, currently the Omicron variant, it doesn't seem to cause as significant an illness as the Delta variant does. But as you've reported, some people will still get sick. And when you have so many cases, even a small percentage of a massive number of cases will still end up being a lot of people that require hospital care. So we still have to be careful with this.
Yeah, absolutely. Why is the virus raging in some countries and doesn't appear to be in others? Is it just a question of time before those other countries catch up?
Yeah, I believe it is. I believe it certainly is a matter of time, because this is so transmissible, and because this virus or this particular variant chips away and erodes at some of the protective immunity that we have either from vaccination or recovery from infection. We're seeing a lot of people who are getting infected. Now, of course, we know that people who have been vaccinated or people with prior infection probably aren't getting as sick versus people who have never seen the virus before or been vaccinated before. But I think it is just a matter of time before we see most places in the world have an Omicron wave. Hopefully it'll be mild, but I think everyone's going to have an Omicron wave at some point. It's just a matter of time.
Isaac, let's end with a theory that's been proposed by The Economist. In an article, it's mentioned, a very, very recent article, that as far as it can see, its analysis is that the coronavirus will begin to wane in the year 2022. And then in the year 2023, for richer nations at least, will not present a danger. What do you make of that?
Oh, well, fingers tightly crossed that this last wave is enough that either everybody has been either vaccinated, infected and recovered, or some combination thereof. Now, of course, we need to really double down on efforts for global vaccine efforts. But once we have enough community level protection, and once there's significant numbers of people around the world who have antibodies and their other branches of their immune system primed to fight off this infection, subsequent waves of COVID-19 that roll through town will still cause infection. It just won't disrupt us and disrupt society as significantly as it has in the past couple of years. That's obviously the goal. I think that's not unreasonable. Having said that, we've got to be very careful with predictions, and I'm very skeptical of anything that anyone predicts anything more than 6 weeks ahead. I mean, I think we have to have some degree of skepticism, but I still think that's a very reasonable theory, and we all hope that it's true.
Thanks so much for sharing your expertise with us, Isaac. Really, really appreciate it. Isaac Bogoch in Toronto, Canada.